Hello, this is the daily COVID update from Deccan Herald. I am Akil Kadidal. In the next few minutes, we will bring you updates regarding the spread of this virus from across India with a specific focus on Bengaluru and Karnataka. At the time of this recording, the total number of cases in India is inching towards the 9,000 mark. Over 7,000 people are active carriers of the novel coronavirus in India. 987 people have recovered since they were first tested. The death toll has climbed to 292. Until last night, more than 170,000 samples for COVID-19 were collected across the nation, among which more than 17,000 tests were conducted yesterday alone. 17 fresh cases were reported from Karnataka today, the highest that have been recorded from the state until now. There are 172 active cases of COVID-19 in the state. 54 people have been discharged so far, and there have been 6 deaths. 4 people are in the ICU. 4 minors have tested positive in the state today, including a 2-year-old child who has been diagnosed with severe acute respiratory illness. Of the 17 cases reported today, the highest number is from Vijaypura. The district has reported 6 cases. This includes 3 minors and 3 adults. Contact tracing is under process for 5 among those, while the 6th has been diagnosed with severe acute respiratory illness. Belgavi has reported 4 cases, all of whom are direct contacts of previously diagnosed patients. Kalburgi has reported 3 new cases. The 2-year-old is among them and has been diagnosed with severe acute respiratory illness, or SARI. The other 2 are direct contacts of previously diagnosed patients. Bengaluru Urban has reported 3 cases. 2 have been diagnosed with severe acute respiratory illness, and the 3rd has a history of travel to Indonesia. The last comes from Nanjangud cluster in Mysuru. A quick look at some of the national numbers. Maharashtra continues to record the highest number of COVID-19 cases in the country. There were 1,500 active cases in the state. Tamil Nadu is next with just over 1,000 active cases. Delhi has 1,023 active cases. Rajasthan is in 4th position at 724. Karnataka is in the 12th position with 172 active cases. A quick look at how various states are trying to curb the pandemic. In the national capital, the government is trying to implement a containment plan at various locations. Medical teams have been surveying homes in the containment zones, and more than 1,000 houses were surveyed in Nizamuddin Basti. Other containment areas such as Sangam Vihar, House Rani and Jahangir Puri have also been surveyed. Drones are being used to add to the surveillance in the old city as well as several wholesale markets in Delhi to make sure that social distancing is being followed. Maharashtra has decided to adopt the pool testing method to try and eliminate the spread of the virus. In the pool testing method, multiple swab samples are placed together and tested in a single real-time polymerase chain reaction or PCR-RT test. If a batch tests positive, then everyone whose samples were in that batch would have to be tested separately. And if a batch tests negative, then everyone is in the safe zone. Pool tests are a way to save time and resources. The state has tested more than 40,000 swab samples, and a strict contact tracing mechanism has also been in place. Maharashtra has referred to the pool tests conducted in Germany and Israel and has sought permission from the Center and the Indian Council for Medical Research to allow the method to be used in the state, particularly in places like Mumbai MMR area. That is a hotspot of India's COVID-19 crisis. Areas like Navi Mumbai, Thane, Palghar and Pune fall into the red zone as they have reported 91% of the cases. The red zones will include districts which have reported more than 15 COVID cases, while the orange zones will cover the areas where 15 or less cases have been reported. The green zones will cover the areas which have reported 0 or 1 case. The state government has decided to categorize hospitals in 3 ways as well. At COVID care centers, 100% asymptomatic patients will be treated. COVID health centers will treat persons with mild symptoms, and COVID hospitals will care for severe and critical cases. Big hospitals like Seven Hills would be able to admit patients of all categories. In Karnataka, the Ethics Committee from the Bangalore Medical College and Research Institute has approved the use of convalescent plasma therapy to treat critically ill COVID-19 patients. In plasma therapy, the blood plasma donated by a person who has recovered from COVID-19 will be transfused to patients tested positive for the virus. The antibodies present in the plasma of the recovered patient help in neutralizing the SARS-CoV-2 virus in the infected patient. The approval from the Ethics Committee is the first step in starting the treatment. In the second step, the Principal Secretary for Health, Javed Akhtar, has written to the ICMR for approval to start using this therapy. Tamil Nadu, Maharashtra and Delhi have already written to the ICMR for approval. It has been reported that Kerala's Sri Chitra Tirunal Institute of Medical Sciences has reportedly got the ICMR approved to conduct a clinical trial. The ICMR is in the process of finalizing the protocol for conducting a clinical trial, after which the Drug Controller General of India has to give a go-ahead. Patients who receive plasma therapy and recover thereafter have to undergo tests for HIV and hepatitis B. Among the protocols that will be established is who will be eligible for this treatment and how much plasma has to be given to the patient. While Karnataka will extend the lockdown by another 14 days, a decision has been taken to exempt fishing and processing activities in coastal districts of Karnataka. Meantime, the Kannada Chamber of Commerce and Industry has appealed to the Principal Secretary, Javed Akhtar, to exclude Dakshina Kannada district from the COVID hotspot or red zone area. KCCI President Isaac Vaz said that Dakshina Kannada district has not reported any new cases of COVID-19 in the last 5 days. He said that people in the district are facing hardships due to unemployment. In the past week, 2 separate incidents have brought the issue of federalism into sharp focus. Earlier this week, a notification by the center barring states from procuring ventilators, PPE kits, and N95 masks created a controversy. The circular came at a time when the Karnataka government had planned to procure 1,000 ventilators from a Mysuru-based company. The plan now remains suspended. According to Deputy Chief Minister Ashwath Narayan, of the 1,000 ventilators the state was planning to procure, it had placed order for 300. Karnataka already has procured around 60 ventilators from different companies and was expected to procure around 1,500 units from the center. Where Narayan defended the center's move, saying that since the ventilators are to be imported, having the center lead the procurement would help in addressing quality concerns and in overcoming logistical issues. Opposition leader and former Chief Minister Siddaramaiah hit back, saying that crucial time would be lost while waiting for the center to act. And at a time like this, states and the center have to work in tandem. In another incident, the center's clarification that corporate donations to the PM CARES Fund will come under corporate social responsibility or CSR expenditure, but not those to Chief Minister's Relief Fund, drew sharp criticism again as it was seen as being discriminatory to states. The Ministry of Corporate Affairs had said that contributions made to PM CARES will qualify as CSR expenditure under Schedule 7 of the Companies Act 2013. But the Chief Minister's Relief Fund or State Relief Fund for COVID-19 is not included in the schedule, and therefore any contribution to such funds will not qualify as admissible CSR expenditure. However, the contributions made to state disaster management authorities to combat COVID-19 will qualify as CSR expenditure. On March 23rd, the government had allowed companies to spend their CSR funds to fight the COVID-19 pandemic, which was notified as a disaster. The clarifications come after the ministry received several references and representations from various stakeholders seeking clarity on eligibility of CSR expenditure related to COVID-19 activities. Moving on to other news from Karnataka, Bengaluru Urban District Administration will set up its surveillance measures in villages under its jurisdiction as the number of COVID-19 and NSARI cases continue to rise. 3 surveillance teams have been set up to check the spread of the disease in 364 villages under 94 village panchayats. This comes after the BBMP ascertained the number of primary and second contacts in these wards. The surveillance team will visit 60 to 70 houses every day. Tumkuru legislator Masala Jairam has been asked to submit a report to the BJP following reports that he threw a birthday party in violation of the lockdown. A video of the MLA serving biryani to people went viral on social media as he celebrated his birthday with children of the government-run school in Idaguru village. The Women and Child Welfare Department has warned that action will be taken against those who use photographs of children to raise relief funds for the situation emerging from the pandemic. In a release, the department has said that several NGOs and voluntary groups have been using children's photos, but this is against the Juvenile Justice, Care and Protection of Children Act. A day after Chief Minister B.S. Yediyurappa said that the state government would extend the lockdown till the end of April, the Karnataka State Road Transport Corporation has stopped all ticket booking for an indefinite period of time. The state-owned transport provider had allowed bookings for journeys after April 14th, but after the extension of the lockdown, officials have stopped booking with immediate effect. According to a KSRTC official, passengers had booked 5,200 tickets for dates post-April 14th. Most of these tickets were booked on April 15th itself. All tickets have been cancelled and the refund process has been initiated. Before we go, spare a thought for those who have been undergoing treatment for COVID-19. Well, the focus has been on attacks on doctors and healthcare workers. Those who face home quarantine and others who test positive for the virus have faced their own share of stigma. KC General Hospital, a designated COVID-19 treatment center, has adopted a novel method of discharging its coronavirus patients to ensure that their patients receive a psychological boost. The doctors, along with other medical staff, make sure that patients walk out to an applause, an acknowledgement of the physically and mentally strenuous journey they have been through. That's all we have for today. For the latest updates, log on to deccanherald.com. Stay safe, stay indoors, and we'll see you tomorrow.